Hey, and welcome to TMI Tuesdays with Lauren and Di. We're your new favorite physios, and we're here to give you the down low on Down There, destigmatizing pelvic health one episode at a time. Hey, and welcome back to TMI Tuesdays with Lauren and Di. I'm Lauren.
I'm Di.
Today's episode is for anyone who's ever sneezed, coughed, or laughed a little too hard and ended up sprinting to the bathroom. Yep, today we're going to be chatting a little bit about stress urinary incontinence.
And it's one of the most common types of leaking, but also one of the most misunderstood. A lot of people think that it's just a normal part of aging or something that you're doomed to live with forever after having a baby. And that really isn't the case.
Or worse, they just accept it. We've had clients say, oh, I just pee when I work out. Doesn't everybody? But just because it's common doesn't mean it's normal or something that you have to live with on a day-to-day basis.
Exactly. So today we're breaking down what stress urinary incontinence really is, why it happens, and what you can really do about it. So if you've ever peed yourself a little bit while doing jumping jacks, this one's for you.
Yeah, so we chatted last episode about the 5 different types of incontinence, and we chatted in a little bit of detail about stress urinary incontinence, but we're going to go into even more detail today. And just like we mentioned last episode, Kegels might help, but only if they're the right thing for your specific body and your specific case.
Exactly.
We'll start with a little TMI tidbit, so a few statistics here. First one, up to 50% of women experience some form of incontinence postpartum, and for many, it doesn't just go away on its own.
Yep. So one study in the obstetrics and gynecology found that if you're still leaking 6 weeks after giving birth, there's a pretty high chance that you'll still be leaking a year later unless you get treatment.
Yeah, and that's why we really push early intervention and why it's key. And not just for new moms, this isn't just a postpartum issue.
And another really big tidbit is nearly 70% of women with stress urinary incontinence avoid specific exercises because they're afraid of leaking. Things that they'll avoid will be running, jumping, lifting, which is really sad.
Yeah, that's a huge number and definitely heartbreaking. It means people are restricting the things that they love to do and really holding back from movement and joy and confidence, all because something that's easily treatable.
Which is really why we're wanting to have these conversations with you, and we don't want to be tiptoeing around it anymore, literally or figuratively.
Yeah, for sure.
Okay, so let's move over into our main topic. So we're going to talk about what is stress urinary incontinence. We're just going to call it stress incontinence for today. So let's get into the nitty-gritty. Stress incontinence happens when your bladder leaks during an activity that is caused by the increase in pressure inside your abdomen or abdominal cavity, and this can be caused from things like laughing, sneezing, lifting, jumping, bouncing on a trampoline.
Yeah, normally your pelvic floor muscles automatically squeeze and lift just before that increase in intra-abdominal pressure down on the pelvic floor. The pressure spikes, and then the pelvic floor muscles kind of seal everything up. But if those muscles are weak, uncoordinated, or the surrounding tissues aren't doing their job, then that's when we get that leakage, which we call stress incontinence.
So I've made a list. We're going to break down some of the most common causes and contributors to this. This is things that we see in the clinic all the time. So one of them would be weak or poorly coordinated pelvic floor muscles. So just because muscles are tight doesn't mean that they're strong. So really important to make sure a pelvic floor physio is working with you to find out if your muscles are tight and weak or just weak, because that'll dictate how treatment is different. And sometimes the muscles, there's a bunch of different muscles in your pelvic floor, and sometimes they're just not working together. The timing just isn't right. It's like an orchestra that's out of sync. Another reason could be you have decreased urethral support after childbirth or pelvic surgery. So if you have prolapse, that is something that might be a cause to your leaking or a contributor. Another one is connective tissue laxity. And this is something that can be inherited or developed postpartum. So when you think of tissue laxity, think of an elastic band. When you first get or a hair elastic, I have one here. It is old and stretched out. When I first got it, it would have been much more bouncy, and now it is got a little bit less elastic. It doesn't have that same bounce back into the same shape as before. And so this can be, connective tissue laxity can be a spectrum. It's not black or white. And so this is something, again, that your pelvic floor physio can assess for you. Another contributing factor could be hormonal changes. Times that we see this a lot is in perimenopause or menopause, or during pregnancy and postpartum. Another reason would be chronic coughing. So again, increasing that intra-abdominal pressure repetitively. This is often from things like asthma, smoking, or acid reflux. Chronic constipation and repeated straining. So if you're having hard time passing bowel movements and really having to apply a lot of stress and strain to have those bowel movements, that can be a contributor as well. This is something that we see with people in the gym sometimes. So breath holding during exertion. So if you're doing your lift and you're doing a Valsalva maneuver where you kind of block off your throat, that can be a reason or a contributing factor as well. It can also be something as small as picking up a laundry basket that's heavy and holding your breath when you do it. Again, there's a spectrum of how much breath holding during exertion is a factor for you. Another one is overactive upper abdominal muscles gripping and creating downward pressure. So if we think of our abdominal cavity kind of like an egg shape at the very top, if we're pushing down, or a balloon, if we're pushing down or creating too much force at the top, that will push down as well. And then another one would be poor postural habits. So things like rib flaring or slumping. Rib flaring is kind of being really proud through your chest and presenting forwards. And a lot of people have a pretty significant arch in their lower back because of this. So if this sounds like you, that's something called rib flaring. Or the opposite is that kind of slumped over posture as well. And this can be particularly interesting during, or not interesting, but can particularly a factor for people during lifting and exercise.
Yeah, I'll speak specifically for the rib flaring one. And why it's a challenge is when our ribs are flared up. So our rib cage, think of it like a big old bell, one of those big old bells that we say kind of bell rung up. What that does is it then forces your pelvis to tilt forwards to kind of compensate. And so what we see is the abdominal muscles and the pelvic floor are not really set up for success. So they can't engage well in that position. And then you end up kind of gripping more through your butt or through your low back for strength and stability. So sometimes for runners, you're a runner, I know you work with a lot of runners, is we see postpartum a lot of runners with that change in their posture and center of gravity through pregnancy. They start to go back to running in that posture. Their ribs flared, pelvis is tilted forwards, and their pelvic floor is actually working really well when we assess it, but it's not being set up well for success in that posture, and then they're leaking when they're running. So sometimes just those little postural changes can make a big difference. But we'll talk more about that in management.
I can say that the good news is that most of these things that we've talked about are all modifiable. And once we identify what specific habits or patterns you have going on in your body, then we can figure out how to change them. And that's where treatment really gets personalized person to person.
Yeah, we're really assessing all of these different factors. And so again, that blanket statement of just do Kegels and hope for the best doesn't work for everybody, because you can see it's not just the pelvic floor. We're looking at kind of your whole system and also how your whole system is working in your day-to-day life. So we'll chat next a little bit about 4 key strategies that we both like to use to help people stop leaking. And we both use these pretty regularly in our practice.
The first one we're going to talk about, I used for a patient today with low back pain. So it's a pretty applicable tip that a lot of people can use.
All right. Yeah. So first one, learning to manage pressure. So we call this, the kind of fun little saying is blow before you go. And so breath holding, like Di chatted about, is one of the biggest culprits for stress incontinence. And so it can spike pressure in your abdomen, and that pressure pushes down on the bladder. Now, I just want to put a little bit of a caveat here, because this is a bit controversial when it comes to the weightlifting world and that whole Valsalva maneuver. And so holding your breath isn't always bad if your pelvic floor is responding automatically in response to that breath holding. But the challenge is a lot of people's pelvic floor actually doesn't, and it pushes down and opens. But I'll let you chat a little bit more about that.
Yeah, so this is something that we see a lot of during strength training or lifting something heavy at home. So example, again, like a laundry basket is one that I talk about a lot. And so we teach the blow before you go, which is basically to exhale before the effort. And this is something that we want to practice with you. So we'll often grab a couple of dumbbells in the clinic or get you to lift things up and practice blowing out like you're you're blowing out a birthday candle just before you lift something up, or maybe just as you're lifting up. Some people find it easier for them to blow and more supportive for them to blow as they're actually squatting down to pick something up. These are all just things that we need to practice and figure out what works best for the person. But basically what we're trying to do is control the pressure in that abdominal cavity so that the pressure is going upwards, and instead of going downwards, you almost have a pressure release valve at the top of your abdominal cavity to support from the bottom up.
Yeah, so what we find is when people hold their breath, it pushes down, and then often the pelvic floor is going down and opening rather than squeezing and lifting. And so we can see, people then don't have the same stability or strength when they're doing things. So for example, your example you gave with somebody with low back pain, sometimes that cue, it kind of gives them more stability or also helps reduce kind of that fight against their movement too. Because when people are holding their breath when they move, they tend to be kind of creating more resistance to their movement. Do you find that as well?
Totally. And this patient I'm thinking of, actually, we haven't done a pelvic floor assessment. She was with me for an orthopedic assessment today, but her history, she has prolapse as well. So we know that there's a pressure management issue going on there. So it's actually a great technique for her. But I do find that being able to give people that blow before you go, I find that people have a hard time in daily life thinking of what their pelvic floor is doing because they aren't muscles that they see or maybe commonly connect with. They don't have that same kind of relationship like they do with maybe muscles of their hand or muscles of their core. And so by giving them a breath to think about, we're getting the right muscles working in the way that we want and creating pressure in the system that we want it the way that we want it to, without them overthinking and over gripping through their pelvic floor.
Yeah, sometimes too many cues and thinking about too many things just makes things worse for people because they're so concerned about, what they're doing and the way that they're doing it. And that movement isn't natural. So I agree. I often, if someone's really struggling with connecting to their pelvic floor, or they just, too many cues, they get overwhelmed. Yeah, going back to the basics, just focusing on the breath is super helpful. And so what that looks like is usually we'll cue, okay, so you take an inhalation, so take a breath in as you prepare to move. Like for example, standing up from a squat or before lifting groceries, you inhale first, fill that abdomen, and then you exhale, you blow before you go, and then you get up out of the squat, you lift the groceries, or even if you're jumping, you land from your jump as you're exhaling too. So again, no, it's not one size fits all. We'll usually play around with it and figure out what works best for that person in front of us.
Yeah. So if it's something that you're struggling with, stress incontinence, then you could try this. It's pretty harmless to try. So it's a good one to start trying, and people find that it becomes second nature over time. They start blowing before they lift everything, which is great.
Yeah, it's shocking how many people hold their breath. I mean, I still do sometimes, even with my knowledge, but I definitely know I used to a lot.
Yeah. Yeah.
So number 2 is the Knack reflex, and we introduced it in our last episode, but the Knack is all about timing over tension. And so this is one of our favorite tools for sneezing, coughing, laughing, even blowing your nose too. Less common, I find people don't leak as much with blowing their nose, but it can be a good tool to practice this exercise with. So the Knack, to kind of recap, it's a reflexive pelvic floor contraction just before that increase in intra-abdominal pressure hits. So just before the cough, just before the sneeze, just before the laugh, we want the pelvic floor to reflexively squeeze and lift.
Exactly. So think of it as a really quick lift, not a squeeze of death. It's really subtle, intentional pelvic floor activation that happens right before you sneeze, laugh hard, pick up a toddler or a baby, or a weight, or right before you clear your throat or you cough.
Yeah, so when timed properly, the Knack actually makes a world of difference for a lot of people. I've had clients, I don't want to speak for you, but I'm assuming for you as well. We've had clients where their leaking has stopped completely just from learning the Knack. And this can be paired with the last strategy of blow before you go. If, again, it's not too many things to think about for somebody, but it's the same sort of concept as we want to get things going up and out when there's an increase in pressure rather than the pressure letting everything go down.
Yeah. Exactly. So we'll move on to our third strategy is pelvic floor strength and coordination. So yes, we do actually need to strength train the pelvic floor sometimes. So we want to make sure that when we're teaching people that, it's not just about clenching or having a death grip on your pelvic floor on repeat and all day. Pelvic floor contractions or strengthening exercises need to be done functionally, they need to be done well timed, and they need to be progressive.
Yeah, honestly, most people think they're doing them effectively and properly, but majority of the time we're actually seeing people use a lot of other muscles for it, like they're clenching their butt, they're sucking in their abs, they're holding their breath, using their inner thighs. Most people overdo it. Like they think more is better and more intensity is better. But the more intense of an effort you produce to do it, it actually skips over the pelvic floor. The pelvic floor activates at a lower intensity. And so you're actually being counterproductive by trying too hard a lot of the time.
How I explain it to a lot of people is that until you've had problems, you've probably never thought of your pelvic floor before in your life. And you've never had to really feel your pelvic floor do a big, strong contraction most of the time. Just because you have a problem with your pelvic floor now, when we go to try to fix it, we want to get back to that state of equilibrium where you're not having to think about it all the time, or you're not feeling a big, strong contraction. It's kind of working in the background for you, and it's doing its job without being front and center. And so by thinking of getting them to that point where the muscles are working appropriately, but at the right level at the right time. So, for example, if you think of another part of your body, if your shoulders are up by your ears or your jaw is clenched all the time, and you start kind of seeing stars when you're trying to contract your pelvic floor, you're doing way too much. You need to tone it down. We often get people, or at least I do, get people to do a pelvic floor contraction and then back off 50%. And I find that's usually kind of a good place to start.
Yeah, the number of times in a day I say don't try so hard, it's a lot, and it's so counterintuitive for most people. They feel like they're not doing enough.
It's like doing something but doing nothing. And I think that's the most accurate description of doing a proper deep core and deep pelvic floor contraction.
Yeah, if somebody's watching you, they shouldn't be able to tell what you're doing other than you might look like you're concentrating on something. But we shouldn't be able to see any kind of movement from the outside happening. Yeah. And I'll throw in one other fact, kind of nerdy and might not resonate for everybody, but the pelvic floor muscles are actually what we call type 1 muscle fibers. So they're endurance muscle fibers versus our quad muscles and our thighs. Those are type 2, which is called fast twitch muscle fibers. And so we need those to come on quickly and forcefully to get us up off the floor or up out of a chair or to jump. Whereas our pelvic floor muscles are slow twitch and they kind of come on and off often throughout the day. And so that's why if we try too hard, we jump over those slow twitch and kind of get into the fast twitch muscles. So just to get a little extra nerdy there for the nerds listening in the audience or crowd or listeners, whatever you want to call it.
Okay.
Definitely no crowd.
How do we actually do a pelvic floor strengthening exercise?
Yeah, thank you. Get me back on track here. So we usually start with foundational work. So we usually assess to start off in supine. And so that's where we'll usually start because gravity is taken out of the picture. So supine. Yeah, sorry, thank you. Lying on your back. So lying on your back. I often have people put their knees out on a pillow or on pillows so that their inner thighs are relaxed. So on your back, and then we'll go into maybe side lying on your side, hands and knees, and then into sitting, standing. So we start with just isolated positions, so just positions without movement. And then once you can connect well, you can really feel it well, and then we add movement to it. So during squats, during lunges, then we add in impact. So during jump squats, during jump lunges, box jumps, things like that. So it's like a ladder. We progress up.
Yeah, it's progressive overload, the same principles that we would use for strength training any other part of your body, your biceps, your glutes, and your pelvic floor adapts when you challenge it appropriately.
Why don't we apply some of these concepts to some real life movement? So we can start with a low impact strength exercise like squats, deadlifts, bridges. The problem often we see is that people are holding their breath when they're doing these exercises, and potentially in deadlifts, maybe poor posture, that kind of rib cage pelvis alignment. And then that's causing downward pressure on the pelvic floor. So to fix this issue, we'll maybe start with cueing, inhaling, breathing in on the way down, or say for a bridge before you even lift. Then we'll cue exhale, lift the pelvic floor, and then bridge up or come up from your squat or come up from your deadlift. And like we talked about earlier, we can play around with it. Maybe we're cueing it more on the way down, but just figuring out what feels best and works best for you.
Yeah, so I'll talk a little bit about high impact movements, things like box jumps, running, skipping. So for example, we'll start with box jumps. So one of the things is technique. We want to think of landing softly with your knees bent. For many reasons, this is important. We don't want to jar any of our other joints, but we don't want to add excess load on our pelvic floor. So when you're landing, I often get people to think of landing quietly so that you're not having that really strong ground reaction force coming back up into your pelvic floor. And I get people to try exhaling on landing. So they're breathing out, maybe they're using that blow out, that like big breath out when they're landing. Sometimes we'll cue a really quick pelvic floor lift just before or on impact. That helps. We often, for high impact movements at my clinic, will use the shuttle, the leg press, or the Pilates reformer so that people can do these high impact movements laying down first and then move them to standing, just because, again, gravity, we're augmenting gravity with that. So it's just another option. When we think about running, we really focus on the posture. Lauren talked a little bit about that bell rung position. And often I get people to think of when they're doing their runs, starting in a ski jumper's lean. So before you start to run, instead of running upright like this, you're kind of on that 45-degree incline, like you're falling forwards. And that's a good way to think of being in the right posture. Some people also think of tits over toes. So are your nipples pointing down or are they pointing up in the air? We want them pointing down kind of over top of your toes so that you're in that forward lean. Take some of the pressure off of your pelvic floor when you're running. We talk about breathing when you're running. So are you holding your breath? Are you breathing really apically, or can you get like a nice rhythmic breath going? And sometimes that's just in terms of changing your music or what you're listening to when you're running. That can be really helpful for that part of things. And then again, overstriding. So we don't want you reaching forward with your feet as you're running. You want to keep your feet spinning quickly and underneath you. Things like hills can be really helpful. Going uphill is a little easier on your pelvic floor typically than going downhill. Even can be easier than running flat. So starting on an uphill can be helpful. And when you're going uphill and things are getting really hard, or you're doing stair runs maybe, trying to really breathe through the hardest part of your run so that you just know you're not holding your breath. And then I'll talk about skipping really quickly. When you start skipping, if skipping is your activity of choice, you don't want to start with double unders. You want to start with single skips. Maybe you're doing kind of that boxer skip where you're side to side and then jumping 2 feet at a time. Practice your breathing. So maybe you're exhaling as you go to spin the rope. You don't want to rush it. You want to have nice, smooth breaths, and you want to have a soft landing again. So you're decreasing that force that the ground's pushing back up into your pelvic floor. You could also try doing a little pelvic floor lift maybe for the first couple impact or just before the first couple impacts when you're skipping, and seeing if that kind of gets your pelvic floor online.
Yeah. The double unders, I find a lot of people kind of jump into double unders too quickly, and they don't maybe even necessarily have the cardiovascular stamina yet to do double unders. So their shoulders are up to their ears and they're just trying to power through to get it done. So it's not necessarily that their pelvic floor is not ready for double unders. It's just their whole system hasn't been kind of built back up to the double unders, and the pelvic floor is just one symptom of that.
Yeah, I know you work a lot with CrossFit athletes, so do you want to talk a little bit about double unders and how we can maybe work on if that's someone's goal, how they can build up to that?
Yeah, so kind of similar to what you just chatted about, but we want to break it down, right? And that's like everything with impact and running is we've got to follow that ladder approach. So first of all, can you find the sweet spot of where you're not leaking? We got to pull it back. So can you do box jumps, jump squats, one-legged hops without leaking? And if you're having trouble there, then we start working there, we pull back even a little bit more. If that's going okay, then we start to introduce regular skipping. And maybe that's one-legged skipping or running. I don't know do you know the technical term for it?
Boxer skipping.
Boxer skipping. Thank you. Yeah, where you're sort of running or alternating your feet. That's lower impact than both feet together. So, okay, can you, keep your shoulders relaxed, maintain that breath pattern, maintain that forward tits over toes position when you're doing boxer skipping. Then, if that's going well, moving to regular skipping, 2 feet jumping. If you can do that for a minute and then you start leaking, then we usually work in that sweet spot. So let's do reps and sets of that 1 minute mark. So you do a minute, you take a break. You do another minute, you take a break. If you feel good after a minute, then maybe we increase it to a minute 15, a minute and a half. So we're trying to build that up. And then once you can have almost an infinite capacity there, then we start to introduce the double unders. And again, we can hear a lot people are leaking after 5 double unders, 10 double unders. Okay, so let's work below that leaking point. So maybe we do 3 to 5 rounds of 4 double unders, right? And building that endurance and that capacity that way. So think of it as less of an aerobic exercise and more of like a strength exercise, and break it down into the reps and the set.
Yeah, it really comes back to strength training just like we would any other system or part of the body. This is just a bit more specific to the pelvic floor. Let's go into some day-to-day activities where you might be seeing that you're having problems and what you can do about it. So we're going to talk about coughing, sneezing, and laughing. If you're experiencing leaking with these things, I would often get people to try the Knack. So that quick pelvic floor lift just before they're about to sneeze, laugh, or cough. And that can often really help. Lifting kids and groceries. This is where I find that the blow before you go can be super helpful. It's that exhale or blowing out a birthday candle just before you're about to do the hardest part of the movement. Making sure that your posture is great. So avoid rib flaring and keeping your spine in what we call neutral or not arched too much one way or the other. And then the last one that I'll go into is getting up from a chair or a car. And this is one that people often find they might not get a big gush, but they'll get a little bit of a dribble from. And this is often one that is a postural one that posture can really help change. So looking at how someone is getting up from that seat, can you maybe lean forward with your chest a little bit? Make sure that your ribs are down so that you're not in that bell rung rib flare position. And then also exhaling just before they're about to stand up can be really helpful as well.
Yeah, I find people, especially getting up from a couch, they're kind of leaning back and sinking into the couch. And so they just sort of hold their breath and fling themselves out of the couch. Yeah. And so we'll move into the 4th and final strategy, whole body integration. So this is often the most overlooked, but your pelvic floor does not work in isolation by itself. It's part of a team, your diaphragm, your core, your hips, your glutes.
When someone's leaking, we want to really zoom out. So are they stacked? Are their ribs over their hips, and their hips, are they tilted too far forward or back? And are they gripping with their upper abs or gripping their jaw, clenching their jaw? So I often ask about things like, do you have TMJ, or has your dentist told you that you grind your teeth? These are cues that you might be clenching or holding tension throughout your body without realizing it.
Mm-hmm. Sometimes the pelvic floor is actually just struggling because of a lack of strength elsewhere. So do we need to build strength in the rest of your core, in your glutes, in your legs, even in your upper body? And it's not just isolating pelvic floor strengthening, but building more capacity and strength throughout the rest of your body. And then, like we chatted about, rib cage over pelvis, diaphragmatic breathing, functional strength that builds that capacity and not just tension.
Yeah, and the great part about that is that in the end, we're not just training the pelvic floor to fix leaks, we're really building a better moving person all around.
Yeah, we want somebody who doesn't avoid workouts, who doesn't avoid trampolines, or even laughing with friends. And we want somebody who trusts their pelvic floor. They know it's strong, responsive, and totally trainable.
And so we see people that come in and they are fine wearing a pad all day. And while that is one solution, we would love to help you get to the point where maybe you don't need that pad all the time.
Yeah. Yeah. So when you're sneezing, deadlifting, or doing double unders, and you're leaking, know that there is a better way.
Okay, so we're going to move into the WTF, what the fact, and it's my turn this week. So I've just pulled up my fact, and we're going to kind of skip back 2 weeks and talk about hemorrhoids really quick. So you know that by the age of 50, over half of all people will have had hemorrhoids. That's over half. This is from John Hopkins. Yeah, this is what they're reporting. They're talking about men and women together, which is interesting too. They're not specifying men versus women, but over half. I'm sure you know this, but there's 3 different types of categories of hemorrhoids. There's internal hemorrhoids where they're inside the anus and people might not see them, but they might still notice that they're there, have the same symptoms. It could be the skin around the anus, so it could be an external hemorrhoid, or the third is it could be a mixed internal external hemorrhoid, and the symptoms will vary based on the location of them. So what would you say is, in your opinion, when do you think people would get hemorrhoids the most, women specifically?
Definitely a lot during pregnancy. That's super common. There's more weight and pressure down on the pelvic floor. We tend to find motility, so the speed at which things move through the intestines, that tends to slow down as well, whether that's due to hormones or just blood flow and things. And so people tend to spend more time on the toilet. And so the longer you sit on the toilet, the more those veins, because hemorrhoids are veins, they get compressed when you're sitting on the toilet for a long period of time, and so they lose the blood flow, and that causes them to kind of inflame and stretch out. So am I right on that?
You're right. So exactly, women most, but when women experience hemorrhoids the most, it's often during pregnancy and childbirth. So the weight of the baby also puts more stress on the blood vessels in the pelvic area. And then when you're pushing the baby out, it can also put more stress on those blood vessels, leading to hemorrhoids. Fun fact about hemorrhoids, that over half people before age 50 will experience them. And so I think it's really important to people to go back to the podcast that we did 2 weeks ago, I think it was, all about strategies on how to decrease straining and how to poo properly, using things like the squatty potty and looking at your fiber in your diet and straining techniques so that you hopefully don't have hemorrhoids by the age of 50.
And is it true that once you have them, like they shrink, but they don't ever go away, right? Because the vein it inflames and it stretches. And so it can shrink and be not inflamed anymore, but once you've stretched it out, it's more likely to get re-inflamed again. Is that true?
I'll be honest, I'm not a hemorrhoid expert, but this is my understanding. I've had patients and friends actually go and get them banded, where they basically take out that portion that is stretched. That is the actual only way to not have that just happen again.
Yeah. But also, you're not doomed if you have them. Like, people can keep them at bay, and if they're not inflamed, they're not causing you a problem.
Some people have them, don't even know they have them.
Yeah.
Should we move over to audience questions?
Yeah, let's do it.
Do I need to stop strength training until I stop leaking?
No, definitely not. This is a common one. Avoidance, right? Especially because leaking's embarrassing. And if you're working out in a public place, it's super embarrassing to be leaking. And so it's very easy to avoid and to stop or be fearful of, am I making it worse? But continuing to train with the right strategies and with the right dosages in terms of weights, reps, sets, and exercise selection is actually the best solution. So the worst thing that you can do is to entirely stop moving and just avoid things because of the leaking.
I think this comes back to the whole exercise is medicine idea that physios really prescribe and really feel strongly about. And I would say that this falls into that category where modifying the exercises or modifying the type of activity is really what we want to do, so that we can keep you moving in, maybe it's a different capacity, until we can get you back doing exactly what you want to be doing without leaks.
So first, we usually look at how you're moving. So if you're leaking during squats or deadlifts, are you breath holding during your lifts? Does just changing your breath strategy help? Are you over gripping your upper abs? So like dimensions, squeezing that balloon and generating that pressure down in the balloon. Or like we talked about earlier, posture, are your ribs flaring? And so can we make some of those postural changes, and does that help or reduce the leaking?
Yeah, we'll often reduce the loading. Maybe from running, we're going to move you to the elliptical. We can help tweak your form, add specific breath and pelvic floor timing cues, like exhaling just before or through effort, adding things like the Knack during lifting, doing the Knack maybe right before you do a deadlift, maybe adjusting your stance to support coordination as well. So sometimes a stagger stance works better than a parallel stance for a squat for some people.
Yeah, and sometimes it's just building tolerance back up. So say you're leaking at, 145 pounds on your squats or deadlifts. Maybe your body's just compensating because overall your deep core isn't strong enough yet to stabilize and support you through that. So maybe we just have to back off on the weight a little bit to ensure your strategy is optimal at that weight, and then building your tolerance and your capacity up from there.
What we really love to see is when pelvic floor training looks just like rehab or regular strength training all rolled into one. So you can be in the gym doing things, and that's also doing your pelvic floor exercises at the same time. That's going to build your function and your confidence so that you're not just dry and not leaking, but you're also strong and resilient.
Yeah, super good point. So we'll probably just leave it at one audience question today. But if you have questions, please send us a DM, send us a note, an email. We'd love to answer them in the next episode. They don't have to be about the episode. This one conveniently was, but we're happy to answer anything at any time.
Okay, so we're going to go through our takeaways. Stress incontinence, which means that you're leaking with coughing, sneezing, lifting, jumping. It's super common, but it's not something you have to just accept.
And most importantly, it's treatable. Your pelvic floor is capable of change when it's given the right support and strategies.
So today we broke down our 4 go-to tools that we use with clients every day. The first one is blow before you go. Exhale with exertion to help manage pressure. Number 2 is the Knack, a quick pelvic floor lift just before a cough, a sneeze, or a lift. Number 3 is looking at strength training and coordination, building control and endurance, not just clenching those pelvic floor or surrounding muscles. And number 4 is whole body integration, aligning your breath, posture, and movement to the pelvic floor, so that the pelvic floor can actually do its job.
Yeah, and these aren't just quick fixes. They're strategies, real strategies that help you move better, leak less, and feel more confident in your body. And they do take training and practice. So don't get frustrated if you can't get it right away. Sometimes it's best to meet with somebody like a pelvic floor physio who can look at what you're doing and figure out where you need to start, because all of these strategies can feel a little bit overwhelming at first.
So whether you've noticed that you've been having this for a long time, years and years, or it's something that's just started for you, having this incontinence, make sure that you know that you're not alone. It is never too late to get help.
Yeah. So keep it tight,
but not too tight.
And we'll see you next Tuesday.
Thanks for tuning in to TMI Tuesdays with Lauren and Di. We hope you laughed, learned, and didn't clench too hard. Please subscribe and share with your gals or guys who may need some pelvic floor love. We can't wait to hang with you again next Tuesday.